Hello, so today we are going to demonstrate CPR. Right now, this is Frank. Frank is asleep, well, unconscious. Anywho, we're going to start from the very top, We're going to check on an injured or an ill person. Frank is going to be my patient. So let's begin. The first thing you're going to do is you're going to want to look around and make sure that your scene is safe. Your scene is safe, then you're going to go over to the person. You're going to shake him. You're going to check for his responses. You want to check to see if he's breathing. I don't hear anything. He's not breathing. You want to look around and make sure there's nothing life-threatening, no bleeding or anything like that. Got to check for a pulse. This patient seems to be not breathing. He seems to be unresponsive. I'm going to call 911 and I'm going to ask bystanders to bring me an AED. At this time, consent is given. It's implied at this point because the patient can't tell me. So yeah, anyway, okay. Sir, can you hear me? Can you hear me? Are you okay? Nope. This patient is not responding. I need someone to call 911, or at that time you would call yourself. And you would either go grab the AED yourself, or you would have someone go and grab it for you, okay? So he comes back, and you're going to begin CPR because obviously he's not breathing. He has no pulse. So we're going to begin. We're going to take 2 fingers and we're going to find right at the bottom of his rib cage in the center. Okay. And I'm going to give him 30 compressions. Just like this. Go over here. I'm going to open his airway, and then I'm going to give 2 breaths. Watching for his chest to rise and fall, which it did. At this point, I would recheck, see if he has a pulse. Oh, look, he has a pulse. Oh, nope, no, he doesn't. So with CPR, he's not doing any better. You would go and do 3 more rounds of 30 chest compressions and 2 breaths. When you're doing the chest compressions, remember, you're supposed to go 1.5 to 2 inches down, and you're going to go at least 100 to 120 beats per minute. So if you think about it, if you have a favorite song, find one that has 120 or 100 to 120 beats to it. Something like Staying Alive by the Bee Gees. It's very fast. It can keep you going if you have a hard time concentrating. So next, we're going to pause this particular scenario. He's not getting any better. My bystanders have now brought me in the AED. My AED is here. I'm going to hook him up. By the way, if I didn't say before, my scene is safe. BSI, I have my gloves on. There is no bleeding or any life-threatening conditions at this moment that I need to address. So at this point, he's unresponsive. We're going to hook the pads up to him. So on a patient, for an adult, you want 1 pad to go on the right upper side of the chest and on the lower left side of the chest. So he would get one here, whoop. One would go here, and the other would go here on the side, okay? And at that point, when they stick properly, I would come over here and I would plug in the AED. At that point, I would plug it in and push the green button, and the green button will then tell you, it's gonna look for a heartbeat. It's gonna tell you exactly what you need to do. If it detects a rhythm, it's not gonna shock him. But if it does, if he doesn't detect it,
adult patient.
see?
If the patient is a child, press the child button.
He's not a child.
Remove clothing from the patient's chest.
Already done.
Open packet and apply pads onto patient's bare skin.
Already done that.
Apply pads as shown in the pictures.
Already done that.
Open packet and apply pads onto patient's bare skin.
Done it.
Apply pads as shown in the pictures.
I have.
Open packet and apply pads onto patient's bare skin.
I've done that, Frank.
Apply pads as shown in the pictures.
We have.
Open packet and apply pads onto patient's bare skin.
Maybe I'm supposed to use these.
Apply pads as shown in the
I'm
pictures.
supposed to use these. These are for training.
Open packet and apply pads onto patient's bare skin.
Yep, that's what I was supposed to do. My mistake.
Apply pads as shown in the pictures.
See?
Open
This is why
packet
you
and
should
apply
always-
pads onto patient's bare skin.
Always
Apply pads as shown in the
know
pictures.
your equipment.
Open packet and apply pads onto patient's bare skin.
Sorry.
Apply pads as shown in the pictures. Open packet and apply pads onto patient's bare skin.
I did.
Apply pads as shown in the pictures. Open
Well-
packet and apply pads onto patient's bare skin.
We have done
Apply
that.
pads as
Shush. At this point, I'm not sure why it's acting the way it is, but I would take my cord and I would plug it in. And at that point, the machine is going to tell you if it's getting a rhythm or not. If he needs to be shocked, it will tell you. Going to shock the patient, you're going to want to make sure that everybody around you stays away from the body. Nobody can touch the person's body while they're delivering a shock. Once the shock is cleared, immediately you're going to go back to your chest compressions and you're going to do 30. And you're going to go another 3 rounds, or 30, another 30 compressions. And then you're going to stop, give 2 breaths, and you're going to let it assess it again. It's going to check again for another rhythm. Still no rhythm, you're going to jump right back in, or it's going to shock. You're going to say clear, and then you're going to continue, immediately get into the position of doing CPR and chest compressions. We need to pause a moment.